spin-off company. And today, I'm very happy to see all of you again. And there will be more participants coming in, no worries. I think it's just the beginning of a webinar. It always such happens. So let me share you something. All right. Okay. All right. So there are a few things before we want to start this webinar we want to ask everyone to do. First is please mute yourself. This is a webinar. Everyone can unmute and speak, and we don't want that to happen. So we try to go through all those things. We just mute ourselves first. The second is turning on your camera is optional. We're not going to force anyone to do. You have the consent for it. And third is if you have a look at it, you can click on this message button here. So this white message box can appear. Type your message and questions in, then send a message box below. And the bonus is click on this raise hand button before unmuting and speaking to us. So today there will be a lot of things happening because we have three very esteemed speakers that I'm very proud to introduce. But let's do some housekeeping. So the first is we're going to do welcoming and housekeeping from Act for Health. And the first session will be bedsore prevention. Associate Professor Dr. Kaur Hui Min, a consultant geriatrician from UMMC, will be speaking for our first session. The second session is we're going to have bedsore management. Dr. Lee Wan Ling, Senior Lecturer, Department of Nursing Science from University of Malaya will be speaking. And then we're going to take a short break. After that, we'll go to a bedsore prevention and product innovation. Who's going to speak for it is Miss Olivia Kwa, the founder of IELDA Asia. And then by 4:50 to 5 o'clock, we will end it. We'll take a group photo and closing remarks from Act for Health. So let's introduce our first speaker. So the thing about the first speaker is when I went through her biography, I think I just felt so proud and felt so like wow a bit because she's a consultant geriatrician and a senior lecturer in University of Malaya, Malaysia. She received her medical degree from University of Newcastle upon Tyne in 2005 and became a member of Royal College of Physicians (MRCP) since 2009. Dr. Kaur has a special interest in orthogeriatric care, dementia, and frailty in the older person. She's a certified lead trainer of dementia care skills for the Alzheimer's Disease Foundation Malaysia. She's currently the Secretary of Fragility Fracture Network of Malaysia, also known as FENM. She has presented many of her research findings, both locally and abroad, as a part of Aging and Age-Associated Disorders Research Group. And without any further ado, let's welcome Dr. Kaur Hui Min.
Thank you very much, Kaylish. Can I just check if everyone can hear me?
Yes, you're audible, Doctor.
All right, okay. Would you be able to help me share my slides?
Yes.
Thank you. And at the slideshow mode, if possible.
Yes, just give me one moment.
Yeah, no problem. Yeah. So while we are sorting out the slides, just want to warmly welcome everyone again, and thank you for the invitation to talk about pressure ulcer. So I think my topic was supposed to be bedsores prevention, but I thought this tagline was really quite cool, so I wanted to just put it in there, which is let's take the pressure off. So I work in the hospital setting, so a little bit of a background of myself. I know Kaylish already said a lot. So I used to work in the UK, and I came back in 2012 as a junior doctor at the moment. So when I came back and I joined University Malaya, and when I was in the ward, I was quite shocked when I was doing ward round, and I come to see how come there's so many older people that have pressure sores. And it was really quite shocking because the place where I used to work, if any older person has a pressure sore, they will automatically be labeled as a vulnerable adult. So that means that something's not right when someone has a pressure sore. But then again, when I came back, it was like as though it's something very common, as though it was acceptable that people stay in hospital long enough to get a pressure sore. But it is not. So that's why it actually stirred me up to do a little research project to look at, why and what happens to older people who have pressure sore, which I will share very shortly in one of the slides. Okay, so I think now the slide is up. So maybe we can go to the next slide. Yeah, so I thought I'll just give a brief definition of what a pressure ulcer is. There are many little different names to it. So some people call it bedsores, can also be called as decupitous ulcers or also pressure ulcer. So throughout this talk, I will use the term pressure ulcers. Pressure ulcers are actually localized skin and soft tissue injuries. So it's actually not just the top surface layer of the skin that we are concerned about. It's also the soft tissues beneath the top layer of the skin that you see. And these injuries can occur after prolonged pressure and shear injuries over the tissues underlying that bony prominences. So next slide. And just a little bit, I thought it would be nice just to look at a little bit about the anatomy and physiology of the human skin. So it gives you a better picture of the kind of injuries that occur in the older person when they have pressure ulcer. So as we all know, the skin is one of the largest organ in our body itself. And the skin has many different functions. It helps to protect us from the ultraviolet radiation. It also forms as the sensory organ that protects us. So especially protects us from harm, from injury, from extreme temperatures. It also works as a form of thermoregulation. So it helps to regulate the temperature inside our body as well, so that our body function and our body organ can function normally. It also helps to prevent excessive fluid loss. It helps to synthesize vitamin D, as well as it helps with the healing process in our body system too. So as you can see, you probably won't be able to see my cursor. If you move back the previous slide, there are many layers to the skin. So you may probably heard of the epidermis layer, which is actually the top layer, and then the thicker dermis layer. That's when your blood vessels are and also where your nerves go through. And then the bottom layer is the hypodermis layer. It's usually where the subcutaneous tissue are. So beneath the hypodermis layer, that's then the muscles already. Okay, so skin comprises of your epidermis, your dermis, as well as your hypodermis. Okay, then we have the next slide. Okay, so when we talk about pressure injury, it can extend as deep as the whole skin layer into the muscles, or even sometimes deeper if it's more serious, into the bony prominence itself. And pressure ulcer is a major challenge in any geriatricians that you speak to in our older population. And globally, it affects nearly close to 1 million older adults annually. And why is that so? Because older people have higher risks due to the physiological changes in the aging skin itself. So if you think about it, on the figure in front of the screen, on the left-hand side is the younger skin, and the right-hand side is the older skin. So as we all get older, we have a thinner epidermal layer, which is the top layer of the skin. And as well as when you look at the blood vessels itself, we also have decreased vasculature as we get older. And if you think about the different collagen and elastin, we have a bit more disorganized collagen and elastin, and hence therefore there also occurs to be wrinkles as we get older. And when you see that there are these changes as we get older, due to the reduced vasculature, you have reduced blood supply to the skin areas, and the skin is more intolerant to hypoxic changes itself. Okay. And if you think about that, if anyone has a cut or a wound, it will take longer for the wound to heal. Okay. And the next slide. So where do people get pressure injuries and in what setting? So in all setting, whether is it in the community, in nursing homes, or in hospital, there are tendency where you will find patients who develop pressure ulcer. And of course, you will see it higher and much higher in hospital setting, because that's usually when people are unwell and hence they have to be hospitalized. And if you think about in nursing homes as well, because that's where you find more older person who may have reduced mobility, hence the risk of developing pressure ulcer is higher. Okay, and those who require home help, they also have that risk of developing pressure ulcer. And if you think about the hospital setting, which wards do you think pressure injuries occur most often? So the more serious the injury, the more likelihood that patients are going to be bedbound for longer. So for example, in the intensive care unit or the high dependency unit, the risk of developing pressure ulcers are higher, as well as in the wards where they look after more older population who are more frail and who are more likely to be immobile. That's also when the incidence of pressure ulcer increases. Okay, so where do people normally get pressure ulcer? So these are some of the common sites that you will find. So the sites are also dependent on what position that the patient lies on most of the time. So if they're lying supine, like this picture in the front, you will find that the pressure injury can occur very commonly in the heel, in the buttock region, in the elbow, the shoulder, back of the head as well. And if their knees are always knocked together, you can also find it at the inner knees. And if they are mostly lying to their side, then you will find it on the side of those regions that I have mentioned. And if they are mostly seated down, especially those who may be wheelchair dependent or sitting on a wheelchair for a prolonged period of time, these are the areas that you should check for. Sometimes when we have patients coming in with specific sites where the pressure injury is, it gives you an idea what position that the patient is most likely always lying on. Okay, so just beware wherever you see pressure injury, it gives you an idea of the position that they are on mostly. Okay, next slide. But don't forget as well, some of the pressure injury can also occur due to other uh, 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 objects that we've put patient on. So some of these medical equipments may induce pressure ulcer. So I put a picture there of, some patients may be on non-invasive ventilation. For example, if they require a BiPAP or a CPAP machine, that's when you see that, at the nose area itself, they may develop pressure ulcer. And during the COVID times, when you have a lot of patients on high flow nasal cannula, where they have the cannula fitted very tightly in your nose region, that is also the area where there are evidence of pressure injury occurring. So be very careful if they have medical assistive devices. Always check. So you've got lots of patients who may get pressure injury near their ears when they have a nasal cannula put in, or even if they have a catheter. Please make sure you check these areas itself. All right. Or if they do have a cast, on the areas of the cast, you have to check at the ends of it whether they can develop pressure injury or not. Okay. Next slide. Okay. So this one, some people ask us this question. So how long does it take for a pressure injury to develop? So a lot of the different studies, they have sort of mentioned that it may take as early as 1 hour, or most of the studies, when they look at it retrospectively, these are usually patients who underwent surgery. So they look at the different times of how long the surgery takes, and how fast did it take to develop pressure ulcer. We thought it was approximately 1 to 2 hours. So that's not just about surgical patients who are having the surgery done, but if you think about patients, who lie on a hard surface for this amount of time, they are also at risk of developing pressure injury. And don't be fooled. We find that obese patients are at higher risk to develop pressure injury. So if you look at the pictogram in front of you. So for example, in patient B, when they have a large amount of subcutaneous tissue, but when they are lying on that specific surface, there is actually higher amount of pressure exerted onto the bony prominence itself. So they will develop pressure injury in a shorter time compared to someone of a normal body weight itself. Okay, so don't keep a patient who is immobile, especially if they are acutely unwell, lying on the same surface for any more than 2 hours each time. So hence, you must ensure that you turn them regularly. Okay, next slide. So why is pressure injury important a topic to discuss? Because there are lots of adverse outcomes with pressure injury. Some patients will complain of chronic pain. So they will get pain across the area where there is pressure injury. They time, it can actually reduce mobility. If you have an open wound, there is always an increased risk of infection, and sometimes recurrent infection, it delays the wound healing itself. Anyone who's developed pressure injury has a huge psychological impact to their mental health itself. It can lead to depression, and that in itself also can lead to a reduction in your quality of life. And not to mention too that pressure injury also increases the cost of care. If you think about not just about medical costs with regards to having to buy the different dressing, but also the cost of informal caregiver who have to take time off to look after the person who has pressure injury. And anyone who has pressure injury has prolonged hospitalization as well, compared to those who did not have any pressure injury on admission to hospital. And when I said that I did a little study on patients with pressure injury, when I followed them up, those with pressure injury have higher mortality risk compared to patients who did not have any pressure injury. And the mortality risk is, about 60% within 3 months. And this is particularly true for patients who are from nursing home, those who have infected deep stage 3 and stage 4 pressure injury, as well as those who have a high neutrophil count, likely suggestive of an ongoing inflammatory or infection going on in the wound itself. So it's important to try and prevent pressure ulcer before it happens, because it really carries a poor prognosis and also a lot of different adverse effects to the patient itself. Okay, next slide. So what causes the pressure injury to happen? Because you will see some patients who lie on the same position for many hours and they don't get pressure injury, whereas there are other patients who lie only just for 1 or 2 hours on the same position and they do get pressure injury. So there's a lot of different risk factors involved. So it's really a balance between how much pressure is exerted as well as what is the patient's tissue tolerance. And if you think about the pressure, so you know what is the period that they've been lying down and their weight, as well as the ability to turn themselves. Whereas if you think about tissue tolerance, you can divide them into the intrinsic factors as well as the extrinsic factors, which I will explain more in the next slide. So for example, you look at the intrinsic factors. So intrinsic factors is mostly to do with the patient factor itself. So those with more advanced age are more likely to develop pressure injury. Those with reduced mobility, who have sensory impairment like neuropathy, those who are lower in terms of their BMI, confusion. I know this is a bit contradictory, right? Just now when I said, patients who are obese are more likely to have pressure injury compared to normal patient. However, those with very low BMI are also at risk because they have very little fat pad to absorb the pressure. Patients who are confused, those who have delirium, patients who have urinary and fecal incontinence, because we know that this excessive moisture can increase the risk of pressure injury. Patients who are malnourished, those who have been physically restrained, because they can't move, And patients who have previous pressure injury are also at increased risk of developing pressure injuries when they're acutely unwell. So if you see that these patients have healed pressure injury in one area, you know that this patient is at very high risk. You need to make sure they don't develop pressure injury again this time round. And lots of different medical condition increases your risk. For example, in patients who have underlying active malignancy, those with diabetes, stroke, pneumonia, heart failure. So basically, to be very honest, if you ask me, any patients with elderly patients with acute medical illness are at high risk already. Okay, full stop. So if they're not well, make sure they don't just lie in bed and not move. You need to make sure that they do move. Okay. So if you think about what are the other extrinsic factors, so you talk about the risk factors of the patient themselves. Now you talk about the environmental factors. Okay, so any pressure from any hard surfaces. So for example, if you put the patient on very hard surfaces for a prolonged period of time, that can induce pressure injury. Or if the patient can't move and you are dragging the patient across the sheets, that actually increases a lot of friction as well as shear injury that increases the risk of pressure injury, okay, as well. And excessive moisture or excessive perspiration that increases the risk of pressure injury. So you've got this intrinsic factor and extrinsic factor. So if both of them both of them come into play. So when you think about preventing pressure ulcer, you have to think about both of these factors when you do so. Okay. Next slide. So I'm just going to go very briefly about the stages of pressure injury. So you have stage 1 to stage 4. So basically, don't worry about reading the different stages. So it basically means that stage 1 is not as deep, and it gets deeper and deeper as the number increases in ascending order. So it's up to stage 4. There is no stage 5 or stage 6, okay? When it comes to stage 4, it means that it has already gone through the whole thickness of the skin and even gone through the muscle layer or even to the bone itself. Okay, and the next slide. But then again, there may be pressure injury that you can't actually quite tell what's going on beneath the skin. So you have this condition called suspected deep tissue injury, where you will see like a blood blister on top, or even changes in the color of the underlying skin. So that tells you that, there is already injury occurring into the deeper layer of the skin, but you won't be able to tell how deep until the top layer comes off. And sometimes family members get very distressed because they will tell us that, oh, I never knew it was that deep. When it came in, it was only just a little bit black on the surface. But when we explain to them that, that's just the surface that you're looking at, but actually the injury is already gone to the deeper layer of the skin and the tissue itself. And you may also have injuries where you just see a black eschar, we call it. So basically the skins turn black, and when you actually have to debride them, you will find that again, the injury has gone quite deep itself. Okay, next. Okay, so when I think I've took some time to explain about all the adverse effects of having pressure injury. So hence it is important to try and prevent them at all costs, okay, because it is much more costly to treat than to prevent, okay. And not only talking about costs, but also because it has a huge impact on the quality of life of the patient. And like it or not, if a patient develops pressure ulcer in our care, it is also a clinical indicator of how well the patient is being cared for. Okay, and any patients with pressure ulcers have higher risk of mortality than those who don't. And an infected pressure ulcer is one of the very difficult conditions to treat as well. Okay. Can you click one more time? See if the picture comes up. Oh, okay, yes. Yeah, so there are many ways that you can assess a patient's risk. So I put this picture in because I've seen this during the times when we were still using pen and paper to write medical notes. And this was what I found. One of the nurses were very, very meticulous in jotting down exactly where the pressure ulcers are, and how it looked like. So we don't think that is the best way to do it, because you can't quite tell a lot of other details. So there are different scales that you can use. Two of the most common one is the Norton scale and also the Braden scale. They are both evidence-based and have shown to have good validity, as well as acceptability to detect patients at risk of developing pressure sores and those who are not at risk. Okay, so next slide. This is a little bit about the Norton scale. So it looks at a patient's physical skin condition, their mental status, the activity level, their mobility, the continence, urinary, and also bowel. Because as we've mentioned, we talk about intrinsic and extrinsic risk factors. So these are the some of the measurements that we use to assess a patient's risk. And when you calculate them, you come to a category whether they are at low, medium risk, high risk, or very high risk. So in each category, they will give you suggestions of how frequent to assess the patient and what are the specific intervention that you should do. Okay, and next. And this one, we are a little bit more familiar because this is what we use in University Malaya, which is the Braden scale. Again, if you look at the category, which is very difficult to see, so we'll go to the next slide that I have highlighted the different domains there, which we look at again at the patient's ability, a sensory ability. So are they able to respond and tell you that they're uncomfortable, they've got pain, or do they have stroke and they have inability to express themselves? And you also look at the moisture of the skin, the activity level, are they able to mobilize in bed themselves, and how is their nutrition, as well as are they any risk of friction or shear during the care or handling of the patient. Okay, and next slide. Oh, okay. So when you can use either one of those risk assessment tool, or maybe you are using other types that you have in where you're working. It doesn't matter. The most important thing is you use something to measure the risk assessment. Okay, and so how often should you do the risk assessment? So if you talk about hospital, we should do it every day. So as patients are being changed or they are a nurse in the hospital, we look at their skin, okay, and you can actually chart. If they have a pressure ulcer, then you can chart what the pressure ulcer now looks like. And when do you do it? So you do it on admission. You do it when there's any change in the patient's medical condition, as well as if they're being transferred either to a different ward or when they have had certain procedure and they've come back, and also on discharge itself. Okay. Okay. So how do you prevent? I've divided it into three main ways. So number one is skincare, mechanical loading, and also thinking about support surfaces. Okay, so about skincare. So look at the skin. This is particularly for if they are doctors, for the doctors to ensure that when you look at a patient, don't just talk to the patient, listen to the heart and the lung, but make sure you look at the skin as well. Okay, and ensure that if there are any areas of the skin that is very, very dry, then you want to use emollient to moisture them, but not excessive moisture, okay? Avoid massaging, particularly over the bony prominence, because that in itself can cause injury. We don't want too much moisture either, so we don't want patients lying on a soak a bed with their feet or with their urine or their feces, because that can definitely cause pressure ulcers to occur very, very quickly. Okay, and also when you handle the patient, make sure you lift and don't drag them across in the bed, and especially when you turn or you transfer them as well. So if you have to, maybe sometimes you're going to have to use a hoist if they're very dependent. Okay, next slide. With regards to mechanical loading, which actually means repositioning. So you need to reposition them at least every 2 hours. So when you turn them to the side, you can use pillows to help keep them in that position, or even sometimes foam wedges. So these are the pictures that I've taken up from the wound care guideline, from the Malaysia wound care guideline itself. And you want to keep, if they are if they're lying in bed, you want to keep the head of the bed at lowest elevation possible. Of course, not when they're eating. Like eating, then they need to sit upright. But if they're just resting, maybe about 30 degrees will be okay. Okay, so like I mentioned earlier, use lifting devices to decrease friction and shear. And if they are sitting on the chair, make sure that they don't just sit there for an hour, that they shift their weight every 15 minutes. Sometimes you might have to remind them to do so. And yeah, so pay attention to their heel, because sometimes they're being covered with their blanket and you can't see their heels, because heel pressure injury are very, very easy to develop. And it's also one of the areas of pressure injury which is also very, very difficult to heal due to the blood supply, and it's at the extremities itself. All right, and next slide. So do look at their heels every day, especially in high-risk patients. So which one are high risk? So you do your risk assessment. If they are categorized as high risk, those are the ones that you want to monitor every single day. And you can also put moisture on the heel, and sometimes you can also put transparent film on their heel to avoid the friction, or sometimes we use foam dressing over the heel area. Okay, next slide. Okay, so for some of these patients, maybe you want them to wear socks to prevent friction. And if they are on their wheelchair most of the time, don't keep them barefooted on the wheelchair. You can actually help them wear shoes if they're sitting in the wheelchair. Okay, and yeah, you may want to consider putting pillows under their legs to support time when their heels can be off the bed. Okay, and sometimes use cushion and consider as well to turn them every 2 hours and reposition the heel. Don't just keep them like that off the bed all the time. Okay, so there are many different types of pressure reducing equipment, and I think Miss Olivia later will probably talk to you much more at length later on. So I'm just going to touch the surface of it. So for high risk patient, we want to consider using pressure relieving mattress that can actually distribute the pressure evenly and reduce shear reduction, as well as the microclimate control. So many different types of pressure relieving mattresses out there. You can find them at 260 ringgit all the way to 20,000 ringgit. So they all come in different types of quality and different sort of function. Okay, so for those patients who already have pressure injury, sometimes we may have to use a better pressure relieving mattress compared to those who may be at low risk. So there are many different sort of foam mattresses, static air mattresses with fluid, fiber, gel, or a combination. So these static mattresses, that means you put in, you inflate them and they're static. Okay, there's no alternating flow within the mattress itself. So these are a little bit cheaper. Then of course you have the dynamic lah. So which has the alternating air throughout each of these foams that you see here, more expensive. So if you have a patient who already have a pressure ulcer on a static mattress, then you might want to consider getting a slightly better pressure relieving mattress for these sort of patients, because they're already developing pressure injury on the static mattress. So you may want to find a better one. Okay. And the next, yeah, so there may be some who are sitting on a wheelchair and they are at risk. Then you can use these pressure redistribution cushion that you use on wheelchair or even on the sitting chair. Okay, so on here you have the black one. It's got little foam like that you can see. Those are called Roho cushion. They are not very cheap, okay, but they are pretty good in itself. Okay, and then you have those gel like one, the one that I've shown on the gray one itself. Okay, but you want to limit the sitting time to less than an hour in patients who already have pressure ulcers itself, and always reposition them frequently. Okay, and the next slide. Oh yeah, some things that we do here in PPUM, sometimes you can refer the patients for pressure mapping. So this is particularly true for those who have spinal cord injury. So you get them to sit on this mattress itself, and it tells you exactly where are the areas where the pressure is the highest, and you want to see what sort of a cushion that they can use to reduce the pressure on those areas. So it's very specific. Okay, and last but not least, it is important to think about nutrition. You can have the best mattress, the best dressing, but intrinsically, if you are not dealing with the patient's nutrition, then they won't have enough uh, vitamins, mineral, calorie, protein to try and heal the wound intrinsically, right? So for any patient with pressure injury, you must refer them to the dietitian for early assessment and intervention. So sometimes poor wound healing is likely associated with malnutrition, maybe because they have low dietary intake or low protein intake. And a lot of patients with pressure injury, they are already losing a lot of protein due to the constant inflammation that is occurring in the wound site. Hence, you need to ensure that they have enough protein. Okay, so you may want to also ensure that they're eating enough. You want to see whether they have any underlying medical illness that is causing them to have a reduction in intake. Okay, and some patients with Rouse tube feeding, you may want to also refer to the dietitian to see whether you can increase the amount of protein level in their intake itself. Okay, next slide. So if they are taking orally, so how much is enough? So we would say in terms of kilocalorie, they need at least 30 kilocalorie per kilo daily. And in terms of protein, it's 1.25 to 1.5 gram of protein per kilo daily. Okay, so that is at least. So a lot of family members might ask me, oh, but then my father or my mother, they got kidney disease, they cannot take so much protein. But to be very honest, when you have a wound, you actually need that amount of protein to help with wound healing. So, and we find a lot of older people who already got pressure injury, they already have very poor appetite. So I would normally tell them not to restrict their diet, just let them eat. Okay? And don't have to be too strict with glucose lah, the kind of sugary food lah. But I would say that, it can be a little bit more relaxer. All right, so we want to ensure that if possible, their dietary intake is through the food that they eat and not just about taking lots and lots and lots of different tablets and supplements. Okay, next slide. Okay, so another thing to address is also pain control. So let's say if they do have pressure injury, you want to ensure that you assess their pain because it can be it's not very nice to have pressure injury and have people clean your wound with no painkillers as well. Okay, so you want to use different kind of scales to assess their pain. So for those who are not able to express themselves, you can use this Wall Baker pain rating scale. Okay, and next. So you want to anticipate the pain. You don't want to just give it when they are shouting in pain. So you may want to give pain medication regularly. Okay. So what we do is that we coordinate the pain medication to the time when you're going to position them or when you're going to clean their wound itself. Okay, and sometimes other things also help, a bit of music, meditation, distraction, conversation, and sometimes for certain wounds, we may even put a little bit of lignocaine on it just to numb the area. Okay, so the goal of caring for an older person, particularly those with pressure ulcer, is not just about looking after the wound and not just about the type of dressing, but it's also about the person. Okay, if we don't manage the chronic illnesses well, we don't manage the acute illness well, then the wound is not going to heal. Okay, and in some very, very frail patients, sometimes healing may not be very possible. So that's when you need to discuss about the goals of care, the ceiling of care, and what the direction is. All right. We do also know that in some circumstances, not all pressure ulcers are preventable, but we want to at least not make it worse, lah, not let it get worse itself. And always remember that it is definitely more cost effective to prevent than to treat a pressure injury. And my last slide. Okay, so older adults are at high risk of developing pressure injury, and pressure injury may cause serious morbidity and also mortality. So there are many, many different techniques that you can adopt to reduce pressure, moisture, friction, and shear, and that will help reduce worsening of pressure injury or even the development of a pressure injury. Okay, so prevention includes managing the medical condition, reduce immobility, and also adequate nutrition. And I think that's my last slide. Thank you very much. I'm open to take any questions if they are.
So, is there any question that you would like to ask Dr. Kaur here? I will give it 3 to 5 seconds, and then I will give the next speaker then. All right. I think probably you are too clear, lah, doctor. So people don't have the need to question then. But it's okay. By the way, thank you so much for doing this session. So now we can move on to the next section. Thank you. Thank you. All right, so let me share my slide for a while. Just give me one moment because we have to go for the second speaker who also is very nice, and also she's such a great person, to be honest. I have no words to even I don't know how can I appreciate her anymore. So our next speaker is Dr. Lee Wan Ling. She was a practical clinical nurse in a coronary ward from 1992 until she joined the College of Nursing, University of Malaya Medical Center, as a nurse educator in 2000. She joined the Department of Nursing Science in University of Malaya in 2011. She has more than 3 decades of experience, including teaching, supervising nursing students in clinical areas. After obtaining her PhD in 2018, congratulations, doctor. She's actively involved in research activities with keen interest in mobile health, technology and education, coronary nursing, aged care, especially in long-term facilities. Across cultural adaptation and validation of questionnaire, health literacy, nursing education, critical care, and NCDs. And among her current projects in aged care research include the local adaptation and implementation of World Health Organization's eye support for dementia in collaboration with Alzheimer's Disease Foundation Malaysia. She is the leading interdisciplinary research working on caregiving credential and music care module. Dr. Lee, please.
Thank you, Kailesh, for your kind introduction. Can you hear me?
Yes,
Can
very
you hear me?
audible.
Okay, let me share my slides. Okay. Is it coming through, the slides?
Yep, you just have to present now.
Okay, let me put it in slideshows.
Yep, just give it a moment. Can you put in a slideshow, doctor?
Now it's not in slideshow, is it?
Oh, it's not.
It's in,
I think you have to share it again after you put in the slideshow. Apparently, yeah, I had the problem with the PowerPoint. It's a
okay.
PowerPoint problem, actually.
All right, okay, let's try again.
Or you can present your window.
Okay,
It's easier.
okay.
Okay. Let me see. Let me see. It's loading.
Okay.
Okay, unfortunately, you have to present in Windows. So you have to stop sharing and share the window and then go to your PowerPoint.
Yeah, I'm showing my window. So is it appearing now?
Oh, no, it's not.
It's not. Let's try it again. Let me see. If I in slide shorters, as it shows. Hmm. How about now? Does this one can see clearly?
Uh, I can see the slides, but it's showing other slides too. So it's not in the slideshow mode.
Okay. I think the slideshows are having a problem.
But
If I adjust it, okay, let me
yeah,
see if I
I
can
think it's
share.
clear. I think it's clear in my laptop actually.
Okay,
All right, we can do
let
it.
me do it like this.
Yes, it's like-
Okay, let me hide this. Okay. Right. What about like this? Are you able to see?
yes, perfect, perfect, doctor.
Okay, looks like we had to adjust it a bit. All right. Good afternoon, everyone. So today I would like to talk about the wound care. I will use the term pressure injuries. So there are many terms that have been described: bed sores, pressure ulcers, diverticulitis ulcers. So whatever it is, you also heard these terms called pressure injury. They basically mean the same. Now, thank you very much to Prof. Ko. I mean, her talk has sort of made my subsequent lecture much easier because a lot of it has been covered, and her lectures give context to what I'm going to cover next. Now, what I prepared actually is actually for Carol, that I was told that among the audience, I think there are some healthcare professional, but no worries. So in this half an hour, I will just get an overview. Basically, what I will share with you, you'll be able to, let's say, convey the information to the patients and their caregivers. Of course, if you really need to know more about the care, the wound care, you will actually need to go for a course. Yeah, we have, I think, 3 to 4 day course on wound care. So today, the aim is basically, an overview. And having said that, I would like to acknowledge my counterpart, Ms. Wan Karunisa. So she's enterostoma nurse therapy. So I'm sort of like liaise with her because usually the nurses at the clinical side, the company that sells the product usually approach them. So they are the one who very much updated what are the current brand there in the market. Right. Now, I was sort of to say, if every time when I meet the caregivers of a patient who have pressure ulcers, I always tell them that pressure injuries can be deadly. Okay. It looks like, some people do not really grasp, the gravity of the problems, but it is can be deadly. And the person who has the pressure ulcer has a 4.5 times greater risk of death, okay, than people with the same risk factors but without pressure injuries. So I always convey that, right? And next is the prevention is number one priority. And what has been shared by Prof. Ko is absolutely important, yeah, that prevention is number one priority. Right now, if a person have a wound, then the next thing we need to say is prompt wound treatment is important because you do not want the wound to get worse. And of course, when the wound is healed, there is a chances of recurrence. So we need to prevent recurrence. So this is a case, if you have seen this, a person who are age 85, okay, staying with her son who works as a clerk. So from there, that she's probably in the B40 group, and she has hypertension, diabetes for almost 3 decades, and she became bedbound after a recent stroke, and she's underweight. She cannot swallow well, so it's an issue of nutrition. And because she's bedbound, right, it's very often she's been put on disposable diapers, and after 1 week of using it, she developed rashes over her perineum areas, and abrasion-like wounds start to appear as sacral area. So this is a very typical case you will see, and then if we do not manage it properly, it can become fourth stage pressure injuries, and it can also be causing complications like septicemia, leading to mortality. Right, so what I'm going to cover today is basically more on wound, right? So, but I cannot just focus on wound because management of pressure injury wound require more than dressing. Now, the part of my slides will be more on dressing. But having said that, I need to also mention about patient-centered assessments, and it has also come together in a package that we need to also talk about infection control and pressure offloading, and of course boosting body immunity. Now, Kaish, if my line got a bit shaky, you let me know, yeah? Right. So let's start off with the first one, patient-centered assessment. So what do we assess? So when we talk about person-centered assessment, I think the Prof. Kaur already mentioned it before. We don't just look at the wound. Yes, it is important to look at the wound, but it is not the thing that we just look at solely. We need to look at the person itself as well as the environment surrounding it. So here, basically, you will see that how we manage wound really depend on our assessment. How comprehensive is our assessment? Because when a person have a wound, it's not just affect physical health. It can also affect their psychological health, right? A person who having in severe pain, and having a pain, it affect them psychologically too, right? Not just physical pain. Now, it also maybe affect their quality of life, their well-being. They're not able, the pressure ulcers. They find that they're, especially those, let's say with spinal injury, they have a pressure ulcers. They will find they don't feel confident to go for socialization, right? They feel their well-being. I mean, there's a lot of effects that can affect a person psychologically. And also, you need to also look at the social and their family background. Okay, whether are they able to purchase some of those products, especially those from a lower income group. And then you look at that whether they do have a, a good caregivers, or are they living in the nursing homes. So these are the few things that you need to take into consideration when you're assessing a person's with pressure ulcer. So not just the wound itself. Now, of course, when we come to assessing the wound, two things we need to look at. First is the staging of the wound to know how severe it is. And the next thing is we want to see whether whatever we do, whether the wound will show signs of healing, because that's important. Whether the treatment and the care that we deliver works well. Now, this is basically when you talk about staging of wound, like Prof. Go already mentioned, we have stage 1 to stage 4. So stage 1 is basically the skin is still intact, but it's a non-blanchable redness. Stage 2, there is a partial skin thickness loss. Stage 3 is a full thickness skin loss. And stage 4 will be the full thickness tissue loss. And we also have some complications, from this kind of wound, such as, okay, we have also sometimes the wound will develop undermining. So undermining is just like the separation, if you see the skin below there, if you put the cotton bud, you will see there is around the edges, there is some dead space, or the pocket below the wound surfaces. That's undermining, right? And then there's also sometimes there's a tunneling. Tunneling meaning that the wound from the top looks like small, but it's go deep down, tunneling into the tissue. And another problem wound would be the slough. Now these are the slough. Basically, they are the dead tissues. Now these are the one that we need to remove it, right? Remove it so that the wound can heal faster and better. And the same thing is scar is the black and brown and tan tissues. And these are the one that is definitely need some debridement. So slough and scar is something that we need to debride so that we can promote better wound healing. Now, I will not go into this, but I can share the material. There's a YouTube there, to show how do we measure tunneling and undermining. Now, usually we document, if the the head is considered 12 o'clock. So we will describe, okay, where is the tunneling and where is the undermining. But because I guess the audience is mixed, but I'll be happy to share the YouTube that to show how do we measure this tunneling and undermining. Now, this is also important, just an overview to understand that that this is how the wound healing. Make it very simple. So there is a part of inflammation phase that need to take place, and in this phase, you will see that the scar, that the blood clots will form. Like if you remember, you cut yourself, and the blood clots will form, and then the more blood supplies go there, bring all your white cells there, and then the form of scabs. And later, you will see the next phase will be the they call the proliferation phase, where you will see more fibroblasts proliferate, and then you see the granulation. These are the new tissues that is building up, and you will see that if you look at the wound, it appears like a red bumpy tissue, but at the beginning, this granulation tissue is a bit fragile, so we need to know how to manage it properly, because the wrong type of dressing, you will sort of destroy these granulation tissues, and that will not be good. So there must be a proper way to promote this granulation tissue, give it some time to become more solid. Okay, later on, as you see that the skins will start to closing up, that we call epithelializations. So basically, this is a very overview of how the wound will start to heal. You will heal from the bottom up as well as closing up to the top. Right, now, another important thing that we need to understand is that the wound need to be balanced. It has to, it need a moist environment in order to heal. And it has to strike a balance. You cannot be dry, because dry wound, it doesn't seem to, it's impact epithelialization. And also when dry wound can be painful. But if the wound is too moist, okay, it's also problematic. Okay? It can cause tissue edema, macerations, and moisture-associated skin damage. So it has to be just ngam-ngam, okay? Moist enough, but not too moist, and it's not dry. And the next thing is, we will start, okay, wound management by assessing the wound, right? Now, if you assess the wound, we use the acronym TIME, and sometimes you will see people also add on two more R and S. So TIME stands for T is tissue. We look at the type of tissue, whether is there any slough, how much is slough, okay? How much is the healthy tissues around it? Then we look at the sign of infections or inflammation. We look at whether the wound is exuding a lot of moisture, or is it too dry. And then we look at the ages, okay, whether see there's undermining, and don't forget the tunneling. We also inspect, is there any tunneling? And if started on treatment, we look at the repair, whether it shows signs of healing. Okay? And of course, if you talk about looking at the whole thing, not just the wound as a person, you also look at the patient-related factors, okay? The social and patient-related factors. Now, when we will document the tissue types and staging. We document the exudate, what's the color of the exudate, the amount of exudate, the wound ages, size, and location. So let's talk about dressing for tissue healing. 3 things you need to remember. First, the principle is, number 1, you need to remove any dead or infected tissues. You need to deslough it, okay? Any of those dead tissues. Right? It can be, if those are severe, we will do for surgery, surgical debridement, but if it's those, they can be managed by using products. We can use chemical debridement. The next thing is, we need to have a balanced moisture of wound bed. As I mentioned earlier on, that wound healing need a moist environment. It cannot be too dry, it cannot be too moist, right? And then remember, if when you put out a dry dress, if a dressing is dry, then when you remove it, you will also cause pain, as well as sometimes you also yank out, those granulation tissue. So it is not good. And the third one is you need to know how to choose the right dressing choice and the technique. Because certain dressing products, they works differently, for a different purpose. So what I'm going to do is next is highlight to you the 3 basic principles of wound dressing. 1, you keep the wound clean, moist, protected, meaning it has to be covered. Next, when you clean the wound, you need to clean the wound at the timely dressing change. Sometimes certain wound dressing you do not need to change every time. Depends on the company. They will tell you change it every 3rd days or 4th days, right? Because as I said that, the granulation tissue that is growing can be unstable. So if you change it frequently, you disturb it, the unstable granulation tissue. So we need to give it some time for it to sort of become more stabilized. Okay? Then the third one is to choose the most appropriate type of cleanser and dressing, because if the cleanser is corrosive, as again, it will destroy the granulation tissues. Now, wound cleanser. What I'm going to do is I'm going to introduce you some of those products that have been used in cleaning the wound, wound cleanser. Now, sorry. All right. Now, the fundamental why we clean the wound, why we need to clean the wound is because the goal is to remove as much as possible any devitalized tissue, any bacterial burdens and exudate, without damaging the viable tissues underneath, within the wound bed. So we always cleanse the wound before we place a fresh dressing. And then here we require attention to both the types of agent we use and the technique. So that's why wound assessment will guide our approach to choose what type of wound cleansers that is required for the wound. Now, the common wound cleanser number 1 would be the normal saline. Okay, these are the common one. It has been a preferred cleanser for most type of wound, but mostly you will see nurses use normal saline if the wound is clean. Okay? If the wound is clean, and you'll find that because it has the kind of concentration similar to human body fluid, so it's not irritating the wound tissues and it causes less pain. Right. However, if the wound is a bit dirty, then you will find that normal saline might not be the good solution, the good wound solution. And for hospital use, if we open up the normal saline bottles, we will discard it after 24 hours of using. Okay, I'll skip this. Now, the thing is, some of the slides I hide because I know I prepared this for different audience. Now, because I'm not showing the slideshow, so I couldn't able to hide some of the slides. Yeah. Now, the next one will be this. Now, normal saline is one. The next one will be sterile water. Now, the sterile water is less popular. Okay. But normally we use sterile water for irrigation if we need to irrigate the wound, right? So you will find that when we want to do irrigate the dirty wounds, then we use the sterile waters for irrigation. Oops, sorry. All right. Now, a few notes there are some wound cleanser is not advisable to use anymore, right? Because they are too corrosive, like pethidine, hydrogen peroxide. This is especially for pressure ulcers. Acetic acids, dakins. Now, we used to use this long time ago, but now we're no longer using it because we find that it's destroying the granulation tissue and it will slow down wound healing. Now, the next, you will find that the popular wound cleanser for the infected or dirty wound will be number one, you will hear chlorhexidine gluconate, 1 in 200 in aqueous solutions, right? And the next one you'll find also becoming a popular, this by the company, selling this wound cleanser called Dermacine. It's a super oxidized solutions. And then what happened is this wound cleanser, they are able to sort of remove the biofilm. Now, biofilm is a matrix that the slimy matrix that it contains microorganism. So they're able to clean this infected dirty wound much more effectively compared to normal saline. Right. Of course, there are many other products which you will hear in the market. Okay, like these baguanites, polyhexamethylene baguanites. You will also hear a product named Protosans for wound irrigations, Opticillin. So now all these products, you need to read the manufacturer's instruction to know what they do in what are the indication or contraindication. So if a carers need to do cleaning of the wound, they would be consulting a wound specialist, a nurse wound, and the nurse wound will tell them which are the products suitable for them. So if you are the healthcare professional and you know someone in need of dressing, refer them to the wound specialist, a nurse wound specialist, who will be able to advise them accordingly to the type of wound. So she will do assessment of the wound and will be able to tell which wound cleanser suits that type of wound the best. Right. So we talk about cleaning it using the right wound cleanser. The next thing is, what do we do to cover it, the wound dressing? So we do have the primary dressings, which we apply directly onto the wound. And we also have secondary dressing, which basically on top of the primary dressing, which act like a protective functions to secure the primary dressing. Okay. Now, purpose of the dressing is basically, there are few. Number one, we want to protect the wound from injuries, and then we want to maintain the temperatures, and then we want to absorb the exudates. And sometimes some of the wound dressing can debride the wound chemically, and then some of the dressing wound can also control and prevent bleeding, reduce pain, and provide comfort. So as what type of wound dressing suitable for the person, refer the persons to the wound specialist who will prescribe the right one according to the needs and the budgets. There are many in the markets, right? So what I'm going to introduce to you would be the types of wound, depending on whether the wounds is dry or more wet, how much exudates the wounds has, and whether it's clean or dirty. Right, so we have to look into the aspects before we can talk about the type of dressing suitable for it. Right. So I start off with the hydrogel. Now, hydrogel, is basically here. The hydrogel is because it has water. So these are the one that's suitable if you want to soften the wound, or the wound is dry, you would like to give moisture to the wound. Right. Now, over here is the other end here would be if the wound is a lot of exudate and you want something that can absorb this exudate and maintain the wound moisture balance, then you will go for the calcium alginates. Now we also have collagens and silicone dressings, and you see that somewhere here, collagens is basically, it's expensive, right? But it works to absorb exudate and help to maintain moist wound. And then we also have a silicone, right? Silicone foam dressings. Now you find that collagen and silicone dressings is not as popular as the next one. You will find that the more popular one would be those from the hydrocolloids and the foam dressings. Right. Now the hydrocolloids, you'll find it here, right? Because most of the pressure ulcer wounds, they are a little bit more moist, they have exudate. So hydrocolloids works well because it's absorbed exudates, forming a non-adhesive gel, and that can be also become like a padding to the wound. And then the next one will be foam. Foam even works much better because it absorbs the exudate even better, keep the wound moist, and also fill up the wound, and it also adds a padding. And if the wound is very, very, has a lot of exudates, then you need something from the alginates. Alginates dressing is highly absorptive, and they make from seaweed, and it really draws this excessive exudates from the wound, yeah, so that you will be able to maintain a balanced moisture in the wound. Now, hydrogel is basically meant for dry wounds. Sometimes we put hydrogel, we apply hydrogel on the slough, that slough areas to soften the slough so that we can easily remove the slough. So that's what it means, the hydrogel. So you have companies, products like Duoderm, Intrasite, Purilons, right? Now you find that if you want to really hydrate the wound, especially if you want to soften the slough, so hydrogel would be a good choice. Sometimes we apply hydrogels for that purposes. Now, hydrocolloids. Now, after we clean the wound, let's say with the machines, then we will apply primary dressings, like these hydrocolloids. You will hear the terms like Duoderms, right? And then Cinteras, there's many products out there. Now, this is hydrocolloids is good for those with low to moderate exudating wounds, and it can also clean and debrides the wound by autolysis, and it helps the body natural defense systems to break down all those dead tissues and promote granulations. Okay. Now, however, if there is tunneling, or infected wound or the fragile peri-wound, then hydrocolloids might not be so suitable. And you see that it's waterproof, right? So it's because it's waterproof. So if you put applications on Pampers, you do not need to worry, if your Pampers it's let's say soy, the hydrocolloid is still waterproof, protect the wound from the stains or from the urine stains in the diapers. And you do not need to change it every day. Normally, you will change it about 2 to 4 days, unless it start to leak it. Now, foam dressing has more power to absorb exudate, right? And it is good because it's also prevent maceration around the wound, and you can see because it has this thick padding. It's very good to cushion the wound, and provide thermal insulation to the wound. And sometimes some of these foam dressing is also have added component into it, like the antimicrobial barrier agents. It has lined with silvers, manuka honeys, antibiotics. Yeah, so you will see. You have to read the products and see what does it contains. So we use a lot of foam dressings, because it also can fill up cavities. As it absorbs the fluids, it will fill up the cavities. And you do not need to change it every day too. You just need to change it every 3 to 7 days. Depends on how much exudates from the wound. Okay. Another one is calcium aginates. Calcium aginates, it's really a highly absorptive dressings. It can. The thing is, one thing, it's expensive. Not all patients can afford it. And you can leave the dressing to 3 to 7 days, and it also has all these components. It seems to be able to stop a bleeding wound, right? So calcium alginates would be a good choice if you see the wound is a lot of exudate as well as bleeding. Right. Move on. Now you also hear things like hydrofibers. Because of time constraint, I will go through very fast. So what I would like to tell you that there's a lot of wound dressing out there, and I guess it will be too much for the audience to comprehend all these types of wound. But bear in mind, there are wounds, and the selection of wound depends on two things: the wound itself. So we need to assess the wound. At the same time, the patient's affordability. Okay, what can they afford? So we need to choose the one that they can afford, right? Now we also have film dressing. This is only for superficial wound. Right. Now that is the primary dressing. Now on top of the primary dressing, we also sometimes secure with the secondary dressing, like the gumji pad and on top, or the gauze pad, or the melanin or primer pour. Now, sometimes, when the wounds get wet, we just change the outside, the secondary dressing, and just leave the primary dressing until it's due to time to change it. Okay? And remember, each time we change a fresh dressing, we need to clean the wound with the right wound cleanser. Right. So as I said again, so dressing really depends on the type of tissues, whether it has infections, amount of moistures it exudate, and whether there is any complications around it, undermining, tunneling, sloughing. Okay? These are the things that we need to take into consideration when we choose dressings. I can share with you that there is also a table, to guide a person to choose, a nurse or a wound specialist to choose the type of dressing for the wound. Right. Okay, this is the same thing repeating. Okay, I also have, sometimes I also share a YouTube to friends who are doing dressing at home. And for uncomplicated wound, and they can do dressings at home. So these are the simplified way of dressing a non-complicated wound at home. They can be done by the caregivers. Right. So I'm going to skip this. Now, next, topical medication. Sometimes we will also apply topical medication, especially if you want to prevent it. Now, we will have, I'm going to skip. Now, we will have all these wound gels, to support healings. Especially if a superficial wound, we have also topical antiseptics for minor wounds. If you remember, when you cut yourself, you apply yellow lotions. And these are only for superficial wound, right? Now, sometimes you hear more products coming. I think Olivia will share more of a products, that will prevent, skin breakdown, to keep it moist, to prevent skin breakdown. Like tridermas, and also you will see, we also, especially those who are on diapers, now we would like to have a good skin barriers. There are a few products, that form a barriers, so that the skins will not be macerated by the urine, the urine in the diapers. Things like this zinc oxide and plus calamine. And we use that quite popular in UMMC, zinc oxide, calamine. Zinc oxide is a barrier, calamine is like a soothing lotions, which is very good to prevent, skin breakdown, when a person is on diapers, especially. And so we also have other products, preventions of pressure injury, like the sirens, Lenovera. Okay, and also we even have the kind of like foam dressing, basically really to protect the sacrum area, because you find that sacral area, heel area, these are the very common area to get pressure injury. So we do have that dressing. We purposely put, as a prevention. Right. Now, when you talk about wound, you need to have a wound cleanser, you need to have a dressings, but sometimes you need to have put some topical medication and also choose the right type of adhesive tape. For adhesive tape, I'll go through very fast. To choose the right type of adhesive tape is very important, because if you choose the wrong type and you tear it off, you will actually create injury to the skins. So what we normally do is we have a micropore tapes. Right, these are the good one. Micropore tapes is actually good for those older people when they have fragile skins. We have transport tapes if you need to have a waterproof, at the same time transparent, to be able to see the wound. And we also have hyperfix, dressing the if you need to have a very strong adhesions to stick well. At the same time, it's hypoallergenic, it's able to breathe, and it's stretchable. Especially if you need to secure it at the joint side, then you will probably need hyperfix, because it can easily stretch. Right. Now, I'm almost finishing. Now, I cannot go off without emphasizing that. Now, you will have a very good wound care, but it doesn't work effectively, or you don't optimize wound healing if you do not control the infections and offload the pressures and boost body immunity with nutrition. That's why it is equally important that, when a person is cleaning the wound. Hand hygiene is important. We teach them how to clean their hand before they start handling the wound. Their working area must be clean. They must prevent wound contamination, especially if they're on diapers. They have to change. The minute it's sore, it has to be changed. Now, even I normally tell, if the caregiver is taking care of their loved one at home, don't put them on diapers 24/7. You need to have a plan out a time when you need to air the areas, right? Air the areas so that you need the skins to breathe, and then protect the skins, with the good skin barriers. Right? If there is an infection, address it promptly with antimicrobial therapy, and look for signs of infections. If you see the pain, there's a new pain or increased pain, redness, warm or prolonged discharge, these are signs of infection that we need to take attention. Right? Infection control is very important. Otherwise, the wound will not heal, or it will be healed slow, or it get worse. Right? Now, of course, pressure offload is important, which has been covered extensively by Prof. Go. I will not be touching it. Right? And lastly, right, nutrition it's a mandatory. You can have the best product, right, but the nutrition is very vital to be able to promote healing intrinsically, from the inside of the body. And then, of course, practice good health. Make sure the person have good rest, exercise and hygiene, because combination of nutrition and good health, it will boost body immunity, so that the body can fight, whatever microorganism that is invading the wound. And so lastly, take home message will be 4. Number 1, I would say that prevention of pressure injury is paramount. Right? And number 2, wound management depends on the assessment of the wound as well as the person. Number 3, you need to clean the wound. Apply and secure the dressing with appropriate product without contaminations. And lastly, you need to prevent infection, keep off loading of pressure, boost body immunity with nutrition and good nutrition. So you need to have this whole package to be able to promote healing, right? At the same time, prevent recurrence. So that's the take-home message from me. Thank you very much. That will be all. And I will be happy to take any questions.
Yes, thank you so much, Dr. Lee. Yes, is there any question from the floor?
Sorry, I exceeded 5 minutes.
It's okay. It's all right. I think there's a lot of things, but after a lot of things that was shared by Dr. Lee. So if anyone have any question, please, I'm opening up the floor to all of you.
I'll leave behind the lecture notes. You can get it from Kalish, for those who are interested. Yeah.
All right. If there is no question, I think again, Dr. Lee, just like Dr. Kaur, I think it's just too, you're too clear that people do not have a need to question actually then. So yeah, thank you so much, Dr. Lee.
Thank you very much for your attention.
Yes. So we understand. It might be a bit too much because I understand there might be a bit too much of information overload just happened just now. So yeah, no worries. We'll take a 5-minute break. Now it's 4:23. We will go. We will start in a 5-minute, which will be 4:28. So yeah, take a bit rest. Let's process the information and then we'll come back. Okay. Thank you. All right. I hope you guys are still with us. And yes, it's so nice to meet you again after a short break. Well, about our next and third speaker, but even though she's the last speaker, but it's not the least, because Olivia Kwa is the co-founder and the executive director of Asian Integrated Medical STM PhD, also known as ILD Asia, a position she has held since 2016. With a background in computational mathematics from UN, Olivia has dedicated a career to improving the lives of seniors. Her commitment to elderly care is very evident through her extensive training and leadership roles in the field. Olivia completed the caregiver training at UMMC in 2022, a course in handling the swallowing and speech problem in elderly from the Ministry of Women, Family and Community Development in 2021. She holds several key positions in organizations focused on aging and care. She's the Secretary General of the Malaysian Coalition on Aging, MCOA. She's the Deputy Chairman of the Association for Residential Aged Care Operators for Malaysia, also known as AgeCorp in Selangor. She had Secretary General of the Nursing Care Association Selangor and CAS. Her expertise has made her a sought-after speaker on topics related to elderly care and assistive technology. The notable engagements including presentation on assistive gadgets for living well with Parkinson's and promoting independence in dementia. Olivia's work with ILD Asia has been recognized in the e-commerce sector, with the company being shortlisted multiple times for the Malaysian Top E-commerce Merchant Awards. In 2022, she was also honored with a Resilient 30th Women Award. Miss Olivia, without any further ado. Okay.
Oh, can you hear me?
Yes, you can. Yeah.
So, hi, good afternoon. Can you see my slide as well?
Your slides is clear.
Sure. So, yeah, my name is Olivia. Thank you for sharing my data. And just now we have two speakers already explained some very good information, very informative sharing. And just a little bit of background of iElder. So actually I started, I'm the co-founder, and our founder is a medical doctor, Dr. Kong Wai Hong. He started this company. It's called Asian Integrated Medical Syndrome Berhad, and he wants to integrate both medicines, the Western medicine combined with the Chinese medicines. So, for myself, and I actually branch up to work on the senior care products. So, on the pictures that you can see, she's my mom. So, 84 years old. And I started iElder simply because of her. She had a 4 accident at home, and I started to source products for them, for my parents, to actually age gracefully at home. So we start searching products and introducing products and bringing in good products, and also helping Malaysian companies to export products to overseas as well. So basically, we are here to actually, until we found a very good Bedsore products that, and this is very, very innovations products that introduced by Dan Medical. I will share the information later for that. So generally, I will talk more about the hardware, that the product suitable for these Bedsore and preventions, and also for the treatments. Not so much on the wound dressing side. So in the Reaper mattress itself, that you see generally, they're very basic Reaper mattress. This is so-called this bubble type, and we also have tubular types. And in terms of just now, doctor also mentioned a few stages, and this is definitely is a very basic one. And this one is actually more to the higher stage. And for the hybrid, what does it mean hybrid? Actually, is also very popular in the market as well. Is actually more to the combination of the foam mattress plus the this tubular mattress 2-in-1. But using this one, that if you do not want to use the Reaper mattress features, you can off it, then it just become the foam mattress. So that's why they call hybrid in that sense. So, and when you come for the replacement ripper mattress, this is more advanced mattress. Then this will helps on the this on top is a ripper mattress and below is a foam mattress. This is a lot of hospitals. They will use it because this combine of two, and you can see these small individuals that tube, and they actually have different type of the different type of the pressure into the each tube as well. So you can set it yourself. But this is more to the more premium stage that quite costly is can more than 10,000 and above. So would like to show you some innovative products. It's called 3C. This is just a piece of cloth, but from here you can see that the piece of cloth like this, but they do wonders. Why? Because inside they consist of 4 layers. These 4 layers of cloth, right? And there's no in between. There's no friction and free for A. So once they reduce the friction, eventually your this skin will be recover in the faster pace. So I show you the video that how does it work.
By the way, we cannot hear the sound. Yeah, the sound is a bit problematic. I don't think so. We can hear the video because you need to share the audio too. Actually,
Oh, you can't hear the sound, is it?
we couldn't hear actually.
Oh, okay. How to put up the
So in the Google Meet, can you see there's like the shared when you're sharing the uh, how to say it in the picture, right? There's a unmuting thing. Can you see you can unmute yourself in the
yeah,
sharing?
yes.
Can you unmute that?
Yes, I unmute myself already. And
Okay.
then
Let's play the video. Let's see if it works now. Things like this always works. Oh no, we couldn't hear too. It's okay, lah, Miss Olivia. I think we could. You could just explain about the video, and then we could go to the next slide if you don't mind. You are muted now.
okay. So yeah. So this just mentioned that this piece of cloth, yeah, is very simple technology that move around. Okay. So but it's so simple that it just is a washable. You can actually put into the washing machine and wash it. So but the mechanism of here that how this really works, because you can minimize storage, because you see when putting the chip in, it's very very yeah. You see there's a simple, okay. So it make this no fiction in. So it's very simple to actually putting the because this is just a piece of cloth, and you can see the mechanism is simple like this, And then there's when you see that the total of 4 layers, and these 4 layers of the cloth, and in between there's free flow of air, there's no friction. So it won't cause you the and the dry skin, and eventually it will help you for the recovery to improve the blood flow and also maintain the healthy tissue. So it will help in the healing stage on the pressure sore. So by looking at this the mapping, you can see this 72 years old, 80 kilos in weight, the mattress itself without using the Trick Easy, and after that using the Trick Easy. So without using that, you see a lot of red spot here, but after using, you can see immediately there's a big difference. So because of the unique design, for the skin shearing, it's crucial for the prevention and also to treat the pressure ulcer. So we've been receiving a lot of testimonial from the customers because this is a new technology and hardly available in the market, but these products already MDA products certified in Malaysia. So and licensed in Malaysia, and we have been introducing to a lot of hospitals. So it will need time over the time, that people receptive about these products, because why they choose Trick Easy, not only proven to actually prevent, but also can able to heal the stage 1, 2, 3, and 4 pressure ulcer. Suitable for healing and prevention, allow the airflow distribution, maintain the skin, healthy skin, and also that when you sleeping on the normal triple mattress, maybe sometimes you feel that very noisy palm sounds, but this actually will reduce that because it's just a piece of cloth, and you can actually put into washing machine, and also transportable, you can bring around, and also give you the warranty. And the risk category can be high risk to the stage 4 as well, low risk to the stage 4. So who is the one that use Trick Easy and recovering from surgery, elderly individual prone to the skin breakdown, and we have been interviewing a lot of caregivers and the professionals. We find that this product is trusted, and also this product actually is from UK and being trusted by the facility over there. So by looking at that, the new innovation products that pressure map at the 28 and mHg, this is actually proven for, and also for the over over the time, actually this product is also very cost effective. So the second items, the innovation products that are very suitable for big sore prevention is this mattress. This mattress actually using the polyester form, but in the top layer, there's a lot of this big sore prevention profile on the upper side. And because of the, this is a 14 centimeter height of the mattress. So when you sleep over the time, this mattress is very, very comfortable to use it for the prevention purpose. Yeah, just now, doctor has mentioned about Roho. It's very popular in the market. So the cost economy side will be the Roho, a Mosaic, and the high profile, low profile, and also Trick Easy also equally good for this Roho protection as well for the Trick Easy. So we have the items, for example, like to prevent, to able to help big sore or maybe pressure ulcer patients to actually move them every 2 hours that you need to do the turning, and this able to help. Yeah, I show you the video, how does it work. So you just easily to push our patient other side. If you have cold, you just open up. Then you use to for this position, put it for 2 hours, and then on the then two flat on the this big big side, and then after that, another 2 hours on the right. So this every 2 hours to me is very useful. So we found that this product also quite useful products for the transfer sheets, because for the bedridden and also maybe the pressure ulcer person that sometimes is very difficult to move them around. So this is a good tools that able to help to do the reposition belts, and also can act as a glove actually to move the patients, because this is very slippery and easily to do the transfer.
Sorry, Miss Olivia, I just want to add on. Sorry for interjecting. This one is actually very good for women who have being a care partner for men, right?
Yeah.
Because they tend to be a bit more frailer and smaller, so it's easier for them also to reposition their care partner, right?
Yeah, so correct. So by looking at these features, right, this video, that this guy is a very big size and you are yourself to handle the patient. Uh, and you need, because they actually have the pressure ulcer, sometimes very difficult to move them around. And this tools is very helpful. Maybe I show you the video on this. So from here is easily to transfer the patients. So this transfer sheet will reduce the friction, and also eventually it helps on the pressure ulcer recovery as well. So let's move to the next slide. Yeah, and the soothing glove that we have, this soothing glove is also very powerful tools. Because it's smooth on the both side. So sometimes the pressure ulcer user, right, and for the caregiver to bring them around, this is a very good waterproof, antibacterial, and also very easy to move a patient to actually adjust their pants. You know, this is a very popular, useful tools in Japan as well. So we also have these cushions. It's a water gel other than the Warhol cushion. These water gel also really good products. And in other countries, this product also can be classified as medical device or the normal cushion. So I will show you a bit more about this amazing test to test this called the balance on seat cushion with water gel. Meaning with this shock absorbent, they tested it. There's actually not pressure on the person, so it will reduce the pressure as well. And also you look at the vibration and also the shock absorption. Yeah, dynamic restoration. It's very long lasting products. Actually it's a very new technology. They're using the water gel. Yeah. And you actually on the big vehicle put on top, you still remain that. So we found these products, and this one been using by a lot of when you see the pressure and you sit on this, you still remain the blood circulation still remain flow up. And you can see by using the pressures this balance on this pressure mapping show you the very positive result. And they also have the non-slip technology onto this as well. And also show you this also very breathable, not even can easily to wash. Yeah. So this is also one of the very good tools to actually reduce that to help on the pressure ulcer as well. So that's all for today's sharing. I actually have more and more slides, but I think just now I've seen the doctors have shown many products for the wound dressing. So I just skip up some of the information on that sharing because totally had put up a lot of information. Okay, I'm more concentrated on the equipment side. Thank you. There is a 20 ringgit voucher. You can actually buy the pressure soap products at IOTA website, as well as you can visit our showroom at SS2 and also Cheras.
All right. Thank you so much, Miss Olivia. It's such a great, we are so blessed to have you here and talking about all this. Let me share my screen a bit because we're going to wrap it up soon, right? But before we go to wrap it up, obviously, we have to ask you some questions, right? So, does anyone have any questions now to Miss Olivia or even any of the speakers in general? I'll give a 5-second heads up. All right, that means there's no question then. We can go for our last about Act for Health. Yes, thank you so much for coming for the talk. We have our Linktree services, our QR code here, and you can please scan it and know more about us. You can actually scan it and kind of go through it and see what do we have at this point. And then yes, so this is our upskilling series. This is for any form of medical practitioners, allied healthcare, or even people, if you're interested in knowing more about this, you can come here. This is continence in older adults. It's an online course. So continence is basically whether you can control your urinary, your fecal,